Hey guys, welcome back. My name is Steve, Defeating Hair Loss. Tonight we're going to talk about, can your hair transplant surgery fail? What would be the reason? Number one, you should have never had a hair transplant to begin with. In a lot of videos I talk about turning away 85% of the patients. We're not really turning them away, we're putting them on the medication. We're trying to find better ways to make them a better patient. Right out of the gates, if you're told, let's do surgery and you have poor, fine, thin, weak donor hair, it may not work. Number two, you're a heavy smoker. Nicotine's flowing through your body, flowing through your veins. Nicotine patients are actually worse hair transplant patients than diabetic patients who have blood issues. So you're gonna have to quit smoking for a few months prior to the surgery, and you can't go back to smoking to a few months after surgery, hopefully forever if you've quit. I take personal credit on helping a lot of patients quit smoking forever, and that includes vaping. Number three, you went and had an FUT procedure done by an inexperienced doctor that was an inexperienced clinic. Maybe you didn't know it. Maybe somebody had a plastic surgery procedure done there, and this doctor said he does hair transplants, and he didn't do it right. Basically how that works is when they take out that tissue doing FUT, they just don't know where to cut. And when they take it out, they're not getting a full sebaceous gland, which is the fatty pad, almost like the roots of the plants that we're trying to transplant from the front yard to the backyard. So if the doctor takes out the tissue wrong and there's no sebaceous gland, none of those grafts are gonna grow. Number four, same thing. FUE though, done by an inexperienced team, inexperienced doctor. They bought a machine salesperson told them now they're a hair transplant doctor, and here we go, we're gonna start doing FUE. When that machine or that clinic or that technician or doctor drill into the back of your head and start pulling out those grafts, it's not as easy as the internet wants you to believe it is. It's actually very difficult. You need to pull out that same sebaceous gland, that same fatty pad that needs to be intact, the roots of the plant for that to grow. So at the end of the procedure, you can look at 3,000 grafts on the top of your head. It looks beautiful. Just like you've seen on the internet, they got no sebaceous gland, none of those grafts are gonna grow. If FUT is done and it's not dissected under microscopes, if the clinic doesn't have the proper technology to dissect and create those follicular units, this is number five, none of that hair is gonna grow. And number six, you've gotta follow post-op instructions. You've gotta do what they say. The clinic is gonna turn this whole expensive surgery over to you, and they're gonna say, now you need to do your part and you need to follow those instructions. So that's number six. And number seven, and don't ever do this, don't let me find out about it. You said you're gonna take the finasteride, you got on the finasteride, your hair got stronger, you had your surgery, and what did you go and do? You got off the finasteride because you read something on the internet. So the reason why you were approved for surgery is because your hair got stronger. Guess what happens when you go off the finasteride? Your hair gets weaker. I wouldn't say that's gonna make it a failure, but it's not gonna be the result you want. I hope these tips help. Thanks for watching. Don't forget to like and subscribe.